Sounds going on, everyone.
No, that's a.
Okay, good.
So there's tile up there, the projector has its stand was spinning.
If I push this,
It should be on automatically, yeah.
doing work while you're here.
Yeah, it's the light. It should be on, I think.
Okay, I think we've got all pieces in place, so let's get started. The time being 9:01 on Wednesday, August 18th, 2021. I'd like to call this meeting to order of the Kane County Public Health Committee. I am Chairman Jarrett Sanchez. Clerk, could you please call the roll?
Silva.
Here.
Lewis. Thank you. Lewis.
Lewis here.
Shepro.
Shepro here.
Strathman.
Strathman here.
Pepe.
Tempe here.
Wallace.
Wallace here.
Urog. Sanchez.
Here.
You have a quorum.
Can I have a motion and a second to approve the minutes of July 21st, 2021?
Shepro seconds.
Pepe moves, Shepro seconds. Any corrections, comments, additions, deletions? Hearing and seeing none. Clerk, please call the roll.
Lewis. Shepro.
Lewis, yes.
Thank you. Shepro.
Yes.
Strathman.
Strathman, yes.
Pepe.
Pepe, yes.
Wallace.
Wallace, yes.
Silva.
Silva, yes.
Sanchez.
Yes.
Passes. Thank you.
All right, finance and budget, the reports on file in the agenda. Does anyone have any questions for the financial reports for Public Health Department this month? All right, we'll move on to public comments on agenda items. I don't see anyone here that I think is going to be delivering public comments. Anyone online? Okay, animal control, we have Brett on the line. Brett, take it over.
Good morning, everyone. How are you today?
We're
So
here.
this
We're
month,
awake.
revenue exceeds
wake up later.
expenses, which is what, I'm sorry?
Brett, it's a little hard to hear you.
Can you hear me now?
Yep, that's better.
Perfect. Good morning, everyone. For our finance, revenue exceeded expenses, which is what we're always looking for. And we're in a very good position in the black right now, which is, again, since we pay all of our own bills, that's what we're always looking for. As for the big news is a week from this Saturday is our next vaccine clinic. We've had tons of calls for it. We're very excited. It's from 10 a.m. to 1 p.m. If you know anybody in your district or especially seniors, please let them know about this program. $10 for the rabies vaccine, then the cost of the tag. This has been such an amazing feature for this county. We're in our 7th year of this. We're so proud of it. And we're so glad that every clinic gets busier and busier to serve the community. And that's what we're always looking for. Other than that, we're planning some interesting stuff I'd like to present to the board coming up. Throughout this COVID event, a lot of people have purchased animals, gained family members, I guess I should say. And we're looking to do some stuff to really increase that bond between animals and humans and getting people back outdoors and do some wonderful stuff at our facility that I'm working on now, and I hope to present to you very soon. Other than that, I'm always here for questions. Please let me know if there's anything I can do for you.
Does anyone have any questions for animal control this month?
Yes.
Oh, Mr.
Shep-
Shepro.
Brett, the last clinic, I think there was a typo in the handout and some seniors had called they were unhappy that they thought they were getting free shots and they weren't supposed to. Did that get cleared up?
The handout has never changed. It's always been the same handout we use every year. We just update the pictures and the colors. So the information's on there. It says free tags, and you need to pay attention to that. Now, there has been retweets of our posting, that has said differently, and unfortunately, I can't control what other people post, but we are very clear to make sure that we always post that it is the free tag that seniors get here in Kane County. I apologize for any confusion. We do have people that come to the clinic and we explain it in detail. We also explain to the people on the phone that call. So we're doing our best to put out the correct information. It is unfortunate that, it's a great thing that people are doing is posting our information on and on because we want more people to see it. It's just a bad game of telephone where after a couple of rounds down, the information starts to change and it's upsetting to us as well. But we agree with you 100%.
Yeah. Well, you can't control social media, I guess. Quick question, follow up. What procedure, if somebody adopts a pet from a shelter like Anderson, do they have to then re-register with animal control and get a new vaccination certificate?
No, it would be the same certificate. It's a matter of whether or not you need to purchase the tag. That tag is the registration that's required by state law, and that's what funds my facility. Anderson does have tags. Sometimes they're using them for their own clinics versus other times they hand them out with the client for adoption. It really depends. We don't have a rhyme or reason for sometimes why they do or don't. But what the rescues usually do is send the certificate to us. Anderson actually has a little type notice they send out with people to let them know to register at our facility with the rabies vaccine. And the rabies certificate does come with them at the adoption. So all they need to do is provide that as proof and we can get them the tag.
Okay. Thank you.
And if I could follow up to one more thing you said, for seniors, what we've told them is email us their copy of their license and email us the certificate, and we've mailed it out. This way they don't even have to come to the facility, and it's been wonderful.
Okay, very good. Thank you for that.
Of course.
All right. Thank you for your questions, Mr. Shepro, and thank you for your answers, Brett. Anyone else have any questions for animal control before we move on? All right. Thanks for being here, Brett.
Thank you.
Now we go on to the executive director section, and we have a few presentations. Strategic planning, Kane Cares, and COVID. Apparently people still want to hear about COVID, so we'll talk about that too.
Yes, good morning, everyone. So I'm Kathy Foster, Executive Director, and I'm going to introduce Claudia Reginato. She is our new Data and Quality Coordinator and has been working with me on the Kane County Health Department's next 5-year cycle strategic plan. So she has put a presentation together to show you all.
Good morning, everyone. I'm gonna provide you some updates on where we are in regards to our current strategic planning cycle. Next slide, please. Next slide. Thank you. So a little bit of a framework in regarding to our strategic plan. So the purpose, to any other organization, is to communicate our priorities for the upcoming 5 years. And this plan is, the strategic plan is a tool to guide us on this decision-making and as well to allocate resources. So we serve, our aim is to serve our community. So the strategic plan is a tool to allow us to do that as effectively as possible. Our strategic plan needs to be in alignment with our Community Health Improvement Plan, which is the CHIP. And also it is a requirement from the Public Health Accreditation Board and more specifically Standard 5.3. And in order for us to remain accredited. Also we need to, we received the recommendation to address specifically domain 3 regarding branding. Our strategic plan also needs to be in alignment with our quality improvement and performance management plan. The time that we have to do this goes from this year went from June to October. So we need to have the strategic plan ready to be submitted to the Public Health Committee on October 20. And we will have roughly 1 month to adjust anything that needs to be reviewed, and it needs to be published by December the 1st. We plan to have it done in 5 sessions, each session 1.5 hours long. Next slide, please. Yeah, so this is a visual representation of our timeline. And you can see here that the red stars represent the planned meetings, and the yellow star shows when the strategic plan will be presented to the Public Health Committee. You can see that before we had our first meeting, we had already completed steps 1, 2, and 3. We were deciding to keep our mission, vision, and values. And actually, we had just completed our community health assessment in 2020. So we had almost all the resources that we needed for our environmental scan. Next slide, please. Here is a breakdown of the strategic planning process, like we planned, and how we are proceeding to that. So you can see that on the first meeting on June, we shared the process for developing a strategic planning. We identified additional stakeholders. We discussed about communication and timelines. We identified additional data that would be needed. And we also discussed trends affecting cane. Right immediately after the first meeting, we sent a survey to our community members and organizations to obtain input on strengths, weaknesses, opportunities, and challenges affecting cane. And this survey was sent to over 1,200 people between community members and organizations. And then on the second meeting, we reviewed the results from that SWOT analysis. We identified cross-cutting themes, and we started to discuss strategic issues. On our third meeting, we reviewed all the cross-cutting themes identified, and we worked on prioritizing those against a set of criteria. And we obtained a list of the themes which we organized, and from what we were able to provide a final list of the strategic priorities that we will be addressing in the upcoming 5 years. So we have our later on today, we have our fourth meeting when we will review that list. We will identify strategic team leaders and members, and we will discuss some performance management elements to guide us in developing goals and objectives. Between meeting 4 and meeting 5, which is the last, there will be work that each team will have to do individually before we have our last meeting, when we will present the plan and finalize it. Next slide, please. So as you can see here, these are the strategic priorities that the health department have decided to address in the upcoming 5 years. So you see that we have 5 strategic priorities, And you see here that some themes that were identified through our surveys and our discussions were included under those priorities. So we have health equity focus, including aging of our population. We have communication, including branding and public awareness, internal and external communication, and access to technology in the community. And workforce development includes QI and PM efforts, staff retention, workforce health, workplace flexibility, workforce education and onboarding, and technology for staff. On funding and funding resources, we have decided as a group that we need further clarification to determine the scope of this priority in order for it to be addressed properly. And lastly, we have strategic collaboration, which includes the identified theme of wellness and preventative care. The leaders that were identified for each priority are Uchi Onwuta for health equity focus, Michael Isaacson for communication, Kathy Foster for workforce development, Kenel Snowden for funding and funding resources, and Laura Barrett who work with strategic collaboration. Next slide, please. So on the work that we have ahead of us, we will develop two levels of plans. One high level, which is contained in this framework. So you can see that for each strategic priority, we have at least one goal, and each goal will have a set of objectives, laying the path from year 1 to year 5 in the direction of providing us the achievement of those goals. And also we have also included here a space for each team to identify any resource that need to be procured and document in this template as well. Next slide, please. And then we have a more detailed level of a plan, an implementation plan that describes the goal. And this is this meaning that each objective needs to be linked to at least one activity or process. And so you can see here that each activity needs to have an activity lead or a responsible person, a timeline in which it will be developed and completed, and then we will have to identify a measure for the process and a measure for the outcome. The process measure is linked to the activity, and the outcome measure is linked to the objective. So any questions here? Next slide, please. So what we have as next steps is having our assigned teams to work each one on their respective priority, and the teams will develop goals and objectives, like I said, for each year from year 1 through year 5. And just a comment that that I like to make, that when we publish our strategic plan on December 1st, and we share it with our community and specifically with our staff. On that day, we have the opportunity to engage other staff members to join specific strategic priority teams. So this way they can share their skills and enhance the effectiveness of each team. So, like I said, our next meeting is set up on to happen on Wednesday, September the 22nd. I mean, next meeting after today, and the next and final meeting. And it's going to take place 1:30 to 3 p.m. And this is it for me. Do you have any questions? If not, you can always send me an email, or Kathy also can address those questions. Thank you very much.
Thank you, Claudia. Yes, this is a very involved process. I think there's about 25 people in the whole group that's working on this strategic plan. So it's, we're taking this very seriously and being very thorough and trying to come up with the best ideas that we can for the next few years of the Public Health Department. Is there anyone that has any questions for Claudia about the strategic plan, the process, anything related to it? Okay, thank you, Claudia, again, for being here and presenting that to us.
You're welcome.
All right, so next up, we have Kane presentation.
Yes, so for King Cares, I have both Laura Barrett, who's our Director of Health or Disease Prevention, and Lisa Bloom, who is our Supervisor for the King Cares program, and they will be presenting today. This was a request, and we're happy to present today with the King Cares program. So thank you.
Thank you so much for your introduction and allowing us to speak today.
Is your microphone on? Sometimes they're a little quiet, so.
You might just.
Hello?
Yeah, if you just pull
There
it
we
closer.
go. Okay.
Yeah, you can
Sorry about that. Again, thanks for allowing us to speak today. I think I try to do this here. Again, I'm going to talk about the Kane Cares program, which utilizes the North Family Partnership model for home visitation. Okay. The Nurse Family Partnership is an evidence-based community health program with over 40 years of research supporting positive outcomes for low-income first-time moms. Okay, so hopefully we can get this video to play. This video is just a great overview of our program.
When I found that I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse Family Partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated, and that's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas.
I feel like I'm the support for them, but they're learning themselves, and it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helps me with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Dad. Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Becky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention on outcomes that are of unquestionable public health and social importance. Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change a community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
Is a great testimonial of what our program is all about. So just this quote from David Olds: "There is a magic window during pregnancy, and it's a time when the desire to be a good mother and raise a healthy, happy child creates motivation to overcome incredible obstacles, including poverty, instability, or abuse, with the help of a well-trained nurse." Our vision is to create a future where all children are healthy, families thrive, communities prosper, and the cycle of poverty is broken. This is kind of an overview of the program. We are currently in 40 states in the U.S. Virgin Islands and some tribal communities. We've served over 317,000 families since the replication began in 1996. And financially, it's very positive. For every dollar that's invested in NFP, saves over $5 in future costs with the families that we serve. To positively transform the lives of the children and the mothers, it takes a community. And we may not see the results right away, but the intervention has shown to have long-term positive effects for the families and for the communities that we serve. Our key goals are to improve pregnancy outcomes, improve child development and health, and improve economic self-sufficiency of the family. In Illinois, it has also been shown that women of color have 3 to 5 times an increase of more maternal mortality. So that's another one of our goals that we are working on. Okay. And how it happens, we employ all of our staff are specially trained Bachelor of Science of Nurses. The program, again, is very research-based, it's extensive, and there's compelling evidence that the intervention works. We start to visit the families during pregnancy, before 28 weeks gestation, and then we visit until the child turns 2. Okay. And currently during COVID, we have been doing all of our visits virtually. So that's added a little bit of a change to our program, and usually we would be in the homes if possible. The first 1,000 days is when our intervention is implemented. And the first 1,000 days of a child's life is so very important, because they've shown that any negative experiences, stress, abuse, poverty, that has very toxic effects, that this intervention can prevent the consequences of those situations from occurring. And then this is kind of a more of a visual of that, the 30-month period prenatally and then through the first 2 years of life, where the actual brain development, the sensory pathways, we can make such a big effect actually on the brain development of that child. And the gold standard of research of the Nurse-Family Partnership involved 3 clinical trials, and these were randomized. The first one was 1977 in Elmira, New York, then 1990 and 1994. And what these involved is different segments of the populations in different areas of the country, urban versus rural, et cetera. And they've all shown positive, replicable, evidence-based research. The 5 domains that make up the Nurse-Family Partnership, all of these are discussed on every single visit that we have with a client. Personal health, which includes in pregnancy will be pregnancy dangers, discomforts, nutrition, exercise, mental health, environmental health, which includes toxins in the environment, personal safety, home safety, like that. Life course development, which is very important to our program, which includes education, employment, job skills training, et cetera. Maternal role, which will be a lot of development with the child, learning, behavior, things like that. And then family and friends, which includes relationships, family support for the client. And some of the outcomes that were seen with these with the trials was a 48% reduction in child abuse and neglect, 56% reduction in ER visits from accidents and poisonings, 50% reduction in language delays, 67% less behavior and intellectual problems at age 6. So again, long-term positive effects. 79% reduction in preterm delivery, 32% fewer subsequent pregnancies, and then an 82% increase in months employed. And again, in Kane County, the Nurse-Family Partnership is known as Kane Cares. We are able to enroll low-income first-time moms in Kane County prior to the 28 weeks of pregnancy. There's no age restriction requirement. And we just recently lost one of our nurses, so we are in the process of hoping to replace her so we can serve even more families in Kane County. And these are some of our outcomes that we've had for our program. One of the ones that we're very proud of is our breastfeeding at birth rate. Our program is at 93.8% of mothers initiate breastfeeding at birth, compared to only 79% and 85% nationally. And then immunizations at 24 months, the Kane Cares clients are at 100% versus 76.7 for Illinois and 88% for national. And then we are above average also for our graduation rates.
Does that mean high school graduation or your
From graduate from our program.
your program?
Yeah.
Thank you.
Mhm. Did you have any other questions?
Any questions?
I have a bunch.
Okay.
Mr. Tepe.
I will try to answer.
All right, Vern Tepe here. First off, really want to thank you for putting on this presentation. I'm the one that's been asking for it for a couple of months. I'm glad we were finally able to get it into the schedule.
Great,
okay?
thank you.
One of the things that kind of brought this to the fold for me is that I didn't hear a lot about it.
Mhm.
So part of the thing is, first off, roughly how many children do you have enrolled right now?
We currently have 42.
Okay, is that significantly down in regard to pre-pandemic numbers?
No, it's not actually. We've been able to maintain all of our clients and actually enroll some also. The number of our referrals has been down. So that's something that has been a concern. And so we're trying to, get out there and do outreach and things like that. But the pandemic has definitely hampered.
Well, I'm sure it's hampered your marketing efforts, plus
Exactly, yeah.
It's disturbing to hear that, that you're doing all of your meetings via Zoom, and that's certainly not, the kind of positive type meeting outcome that you want to have.
Exactly,
Particularly
yeah.
with some of these people. How can we help you market this? Or, if this is something that, in my mind, you need to continue to market it because you've almost got a whole new wave of people every year that end up becoming eligible for this that never thought that they were going to have to utilize services like this. So how can we help market that?
That's a great, offer, and I appreciate that completely. Just let your communities know this program is available. This is for high-risk mothers that are pregnant. It's for a very, you've got RNs that are out there, they're baccalaureate prepared, very highly skilled, working with all sorts of resources and services that they can provide to these very vulnerable patients, clients at this time during their life. So just make sure that your community, when you're out there and you're talking to groups, let them know that this is a program that we have here in Kane County. We're very fortunate to have this in Kane County to serve our community. We are out there also with it, working with the hospitals, working with the doctor's offices. We are also in the process of working with the managed Medicaid plans so that as those pregnancies come on in, they can notify us and we can work because we already know they're going to be qualified if they're on Medicaid. So we're working closely with us. There's a couple pilots going on in the state with getting those referrals going in that process. Our new IRIS system, the Integrated Referral and Information System, that's an online referral system that started in March. And I know you haven't heard too much about that one probably, but that's a huge area for home visiting. That has been huge to help us get those referrals processed quickly and then get in contact with those families very quickly so that we can get them engaged into programs. So those are all areas that we're pushing to get through despite the COVID, despite all our other priorities that we've got going on. But these are areas that we've been working with.
Once you identify somebody who should be enrolled in your system, how much of a challenge is it to get them enrolled?
The quicker we can get that referral and get that contact out to them, that seems to be a huge help for us. Another area that has been really positive, and we've seen that happen again, is referral of friends that are already in the program. If they've got a family member or a friend that becomes pregnant, they'll say, hey, I was in this program. This is wonderful. They gave me great resources, great support, education, information that I needed, and really helped. And that becomes that, that advocate for them during that whole pregnancy. We make sure they get into their appointments, make sure they figured out how to get the transportation, make sure they get in for all those doctor's appointments to get those immunizations done after the child's born. And then the program doesn't end at age 2. We have handoffs to other programs within our county here. So we set them on up so that that child is ready by the time they hit kindergarten. So they may leave our program at age 2, but they're being handed off onto another program that takes 2 to 4-year-olds for that preschool age. And then we get them into the schools and work with the schools with those programs too. So this is not just, it ends at age 2. We hand them off to other programs that have that expertise in that area of that child's life to then hand them off to the next. So that when that child gets to kindergarten, they're ready to go.
Now, are you working with organizations, and they've changed their name, but used to be Greater Elgin Family Service is the example that I'm thinking of. Michael, what's their new name?
Yeah,
Greater Family
Elgin
Health.
Family Health, yes.
Greater Family Health. Organizations like that specialize in low-income people and providing them with medical services.
Correct, we do. We work with all of our federally qualified health centers. So Family Health, we work with the VNA, we work with Aunt Martha's, all those communities. We work with the schools because the school and the nurses in the schools, a lot of times will find out if there's a teen that's pregnant and can get them referred over to our program and get that support for them. Doctor's offices, the emergency rooms, so the social workers that are in there as clients may be showing up in the emergency room. So any of those areas, we're working with all of those. And believe it or not, even the libraries. There's some, great collaboration going on and opportunities there with it. So lots of activities that we're working with, but we're all seeing this decrease with the COVID. That's been quite a challenge, and limiting some of those face-to-face and gatherings. We're just starting to get some of those activities out to go because we can do them outside right now.
Yeah, I'd love to see us come up with ways where we can continue to promote this so that people are more aware of it. And I think the more
We're
aware that
open
they
for
are,
anything. Yes, that would be wonderful.
so I'll be happy to, if I come up with some ideas, I'll certainly let you know, but I'll be happy to try to be a vehicle for that. And perhaps we can get something out to the entire board. So, they're out there working too, but there's a lot of other people I think that, could help. But thank you very much. Great
Thank you.
presentation.
Are there any other questions or comments?
Louis, question, please.
Go ahead, Louis.
I have a question. So most of you know that my daughter is a grad coach at East Aurora High School. And I can think of a time very recently that she had a child that was going to drop out of high school because pregnant, didn't think they had any resources available. Can you send something that I can give that to her that she could do referrals? Because this is a big problem over there, trying to keep these kids in school. And I think this program would blend so beautifully.
Oh, definitely. Yes. Yeah, we could, I could talk to her individually or.
That would be awesome.
That would be wonderful. Yeah.
Do we have any current partnerships with schools or school districts to put this information out to students?
We do. It's, and it's one of those things, you go through and you have that conversation with them, and then staff changes over, or it didn't get to everybody, or they didn't show up for that meeting or whatever. And so you have to constantly keep coming on out to do those reminders, or just, just put it to their, attention, remind them, oh yeah, that program's there with it. It's available. So.
Yeah, I totally agree with that.
All right, anyone else? I do have a question. What's the budget that you guys have for this program typically? Or what is it this year? If that's an average of?
We are funded right now by a grant for this program through ISB, and I think Canal might be on the line, and he may have more to add to this. ISB, the Illinois State Board of Education, provides some of our grants funding for this program. The rest of that funding comes from the Riverboat, which was decreased a year ago by about 42,000 for this program, which eliminated one of our nurses, which was about 25 families that we were not able to serve then at that point. This year, we were fortunate to have the funding renewed so far for the Riverboat for this upcoming year with it at the same rate we were at last year, not what we had requested last year, but what was available for us this past year. We are looking for other funding sources for this program because we realize that Riverboat is going to be a challenge going forward for funding. The state, of course, their funding is also challenging too with those. So, you know, we're partnering with Cannell's team and ours and our Nurse Family Partnership group to see what other funding might be out there for resources for us to continue to work with this to be able to advance and get this growing. The other challenge, as Lisa also kind of alluded to, is the salary structure for nurses is significantly different than what's out there for other nurses and programs. And nurses are always hard to get a hold of anyways, because there's such a demand for that. But I think our salary structure for our nurses has been a very big challenge for us in being able to continue this program with it. So I think that's always for recruitment, yeah, to fill in positions.
When you say salary structures, that's almost seems a euphemism. What do you mean?
The starting salary for the nurses here is quite low in comparison to other RN positions.
Yeah.
It
That is an unfortunate fact that we are dealing with, the low pay that we have for starting in so many positions at the Public Health Department.
Right.
And that's something that hasn't been addressed in the past 8 years. And I think we're doing our best right now, internally at least, to start working on that. But it's not a quick, easy fix.
Correct.
This is a very important program, so thank you for presenting on this. I mean, just my own understanding and reading of, you know, popular books on neuroscience shows even things like arguing in front of children when they're young can have intellectual impacts in their teenage years, which you wouldn't think there's an immediate connection there, but it's how the brain develops and the impact that fear and certain emotions have on different parts of the brain, different glands. So it's very crucial. One of the lines in there, better worlds start with better mothers. And I think there's so much truth to that. So thank you all for making sure that we have this program in the county, and certainly would like to see it expanded as much as we possibly can. All right, anyone else with any questions or comments? Okay, thank you for presenting that to us.
All right, excellent. So next up, we have our usual COVID-19 update.
Good morning. It's a pleasure to present to you this morning.
Uche, is your mic on?
Yes, it is.
All right, some of these mics are just quiet, so you gotta like sit on them a little bit. Yeah.
Can you hear me?
Yeah, that's much
There
better.
we go. Almost have to be on top of that.
Yeah. Some of them you have to back away from, others you have to really speak into. So.
Okay, so I'm here to present to you on our COVID-19 update. So far we have vaccinated 339,540 King County residents first dose, and over 250,000 fully vaccinated. That's about 64% of our total population with first dose, and population 12 plus with first dose is about 75.4%. And we're proud to say that 77% of our population 18 plus with at least one dose is over 77%. And for our population 65 plus with first dose, almost 92%. So our team and other providers in the community have been working very hard. Okay, so King County currently is in high transmission. And some might ask what high transmission means. It means that in King County, our case rate is more than 100 cases per 100,000 in the last 7 days. So in King County, that's about 118.5 per 100,000. So we're over 100 cases per 100,000, and or percent positivity of greater than or equal to 10%. Right now, we are at 6.97%. So if we have a case rate of more than 100 per 100,000, or percent positivity of over 10%, that puts us in that high transmission. And CDC recommends that in areas of high transmission, in order to maximize protection from COVID-19, and in particular the Delta variant, and prevent possibly spreading it to others, everyone, regardless of vaccination status, should wear a mask indoors in public if you're in an area of substantial or high transmission. So that includes all of King County. So I put in a couple, this slide on the variants currently circulating in Illinois. And you can see that earlier on, the Alpha variant, which was the B117, was dominant from early winter all the way till the beginning of July. And then Delta is the one in yellow. You can see how it started, and then it's taken over here in Illinois. And the bar chart, the pie chart is King County. Right now, Delta variant is 71% of all the variant cases. Looking at July 1st to August 16th. Now, just a word of caution about this. We do not sequence all cases, all specimens of COVID-19. We only sequence a few. So based on the specimens sequenced, we're seeing Delta variant as the predominant strain. So what do we know about the Delta variant? The Delta variant is 2 times as contagious as the original strain. That was an error variant. Delta variant is 2 times as contagious as the original strain. It may cause more severe illness than other strains. Infections occurring among vaccinated people, although at a rate less than unvaccinated people, does occur in vaccinated people. This is the reason why CDC is recommending that everyone wears a mask, whether vaccinated or unvaccinated. We also know that vaccinated people infected with the Delta variant can transmit this to others, and that vaccination has been shown to protect against severe illness and hospitalization and death. Unvaccinated people infected with Delta and other strains have more severe illness and or death than vaccinated people. So this is where we are right now. I didn't add more slides because we had a long presentation. So if there are any questions, I can answer them for you.
Does anyone have any questions for Uche? I did have a comment because I see online, you see all kinds of comments, and just amongst people that, you know, maybe they watch the news and get their information from that, or they talk to other people. But so many times I see, well, if the vaccine is working, then why are people still getting sick when they've been vaccinated? You know, we talk about breakthrough cases, And I think it just goes to speak for the lack of understanding that many of us have of how these vaccines are supposed to work. Some people say it's not a vaccine because it's not 100% effective in prevention and reduction. It was never claimed to be 100%. They always said it's going to reduce bad outcomes if you get it. It's going to reduce the possibility of getting it. It's going to reduce transmission, but it's not going to eliminate it altogether. And with this Delta variant, we're seeing higher numbers. But even so, just looking at the state's page, the IDPH page for statewide COVID-19 vaccine breakthrough, the deaths account for only 2.68% since January 2021. And I think that's very notable. When people want to talk about what's the point of getting a vaccine if we're still possibly going to get Delta, well, your outcomes are going to be so much better. Only 2.68% are vaccinated that have died from COVID this whole year. I mean, that number speaks volumes, I think, about the effectiveness that the vaccines actually have.
Absolutely. And just about the first thing you talked about, those who are vaccinated are protected. Vaccination is not 100%. However, if we don't bring up our vaccination rate, there'll be Delta and there'll be so many other variants, because the more the virus replicates, the more it mutates. And we could get a variant that's worse than Delta. That's why the King County Health Department and other public health entities are pushing that we increase our vaccination rate.
Yeah, and just seeing where we're at, it's almost, there's a milestone we passed at 50%. We're at 52% now. So on the one hand, it's kind of like, hey, congratulations, we made it past 50%. But on the other hand, we're still
have a
far
long
off
way to
from
go.
the real goal that we want to hit of at least 70%.
Right.
Mr. Tepe.
Thank you, Mr. Chair. Vern Tepe here. This may be premature as far as the question is concerned, but they've been announcing now that we're going to have to get booster shots, and I'm sure you're going to be prepared for it. So I don't want this to sound like a big question and answer, but I was wondering, just is there any information that you can give other than what I've seen on the news in regard to booster shots?
I'll let Laura, who is Director of Disease Prevention.
Sure, I work with the vaccines, particularly with the COVID vaccines also. We have, and we're prepared at our clinic this afternoon to provide those additional doses. They do classify boosters versus different from additional doses. It's kind of a booster sometimes what you see usually later on down the line with it. But for right now, we have the additional doses that they're recommending for the immune compromised, for the moderate to high level. And those are available for anyone in the county if they want to come in. It's a self-attestation. You don't need to show any proof from your doctor or anything to have that vaccine. We'll prepare to provide those today at the King Vax Hub, and we're there at any of our sites. Is also our healthcare partners are also prepared to provide those too. So the longer term, I know there's been talk out there in the news about getting a booster potentially at 8 months. That information and that we're still waiting for the studies to come out and get the recommendation from CDC. That is a possibility.
Yeah, I can just see a need for us to open up vaccination clinics again and have another series of challenges on your hands. And I know you haven't had enough to do.
Thank you. Yes, and we'll need to watch that with our available space to use and to provide those as the months come on up. So we're watching that very closely.
If you could email me the documentation that you have on what you will do with those kinds of vaccinations, I'd appreciate it. There are quite a few people I send out emails to, and I want to be quite accurate in what information I share with people.
Okay.
So I'd appreciate it. Thank you.
Thank you.
Possible.
Mr. Chairman, Alan, a question?
Miss Allen, go ahead.
Thanks. I'm wondering if we're having the problem of our hospitals filling up. Hopefully, when you might get sick again, but you don't get as sick. But the hospitals are kind of where the rubber meets the road. I remember up here in Elgin, Sherman was planning on opening in their old facility, like an overflow facility in case a lot of people needed hospitalization. Can you tell me if our hospitals still have room?
Thank you for that question. Currently, we're seeing more hospitalization, so the bed availability is going down, but we haven't reached that level yet. So thanks to a higher vaccination rate in Illinois than some of the other southern states where they're having to transport patients out of state, we're not at that level yet, but we're hoping to keep it down. If people wear their mask and follow the right protocol, I think we may not get there.
Thanks.
Yeah, I think what's happening in some of the southern states is a precautionary tale. We want to avoid those kinds of scenarios.
You aren't kidding.
Mr. Chairman,
Ms. Strathman.
Strathman here. I would request that you send that information, if not to the committee, to the whole board, so that we have that information available to us, so we can have the accurate information if people should request it from us.
Yes.
That would be great.
Or even included in the updates that we get every week. That
Yes.
might be just something to add in there.
Yeah,
So that we can
thank you.
see hospitalization rates. Okay, any quick comments or questions here at the last minute? All right. Thank you, everyone, for coming here today and presenting some really good information. It's very much appreciated. The efforts of the health department continue and don't look like they're going to slow down anytime soon, even though it's been a little quieter lately, a little bit maybe.
A little bit.
Since we got past the big waves of vaccinations. So thank you all for being here. We don't have any old business.
Move to replace
someone-
reports on file.
We have consensus, no opposition to that. No need for executive session, no new business, no public comments on non-agenda items. I just need a motion and a second to adjourn.
I moved. So second.
Strathman moves, Tepe seconds. All those in favor say aye.
Aye.
We're adjourned.